Health-related activities can be stressful and overwhelming to anyone at times. It may be that you need a ride, or you won't get to an important medical treatment on time. It may be that you have mobility issues that make driving and navigating hard. If you have fatigue, pain, or trauma, you need to stay as physically and emotionally comfortable as possible. Bottom line, you need time to heal and be well. When you ride with MyHealthDrīv, that is exactly what you get. What's MyHealthDrīv? MyHealthDrīv helps participants have an easier time getting healthy by providing transportation, social support, and healthcare navigation. MyHealthDrīv has caring, trained drivers who become health partners for the entire duration of each round trip. Whether to office visits or to other health-related needs. During that time, drivers help MyHealthDrīv participants get to appointments and medications, pursue their treatment plan, and navigate the healthcare delivery system.
Public transportation does not go everywhere, and definitely not to many of the healthcare facilities. Many patients who can't afford transportation, or they can't afford their medications, or they are uneducated in a sense as to what is most important for them to maintain good health. MyHealthDrīv is incorporating a number of those opportunities to get people where they need to be, to give them the education they need during those rides, and to move their care along in a timely fashion so that they can have the best possible health outcomes.
MyHealthDrīv really helped us a lot. MyHealthDrīv is doing a great job getting my residents. They take them to their doctor's appointments, and they take them there on time, and they bring them back safely, and they do a great job. They're well dressed, very nice, good communication skills, and they help the residents, and they're very helpful getting them in and out of the car, and they're just really good with the residents.
I really enjoy the trips. They're very friendly and easy to get along with.
A veteran of Vietnam. MyHealthDrīv was brought to my attention. They meet my needs. The vehicle's clean, they're very courteous, they get you to your appointments on time. I'm basically stuck in this power chair, so I need the service. It's important to me because they don't forget about you.
The driver is good, he's safe, he's courteous, he's on time, the cars are clean, you don't have to be afraid of the drivers because they're all good.
They're clean, they're polite, they're very attentive, they drive safely. I'm really so impressed with them. I don't know what we would do without them.
The transportation that we have with MyHealthDrīv is wonderful.
To be able to work with CommHIT on MyHealthDrīv has been absolutely amazing. The impact that we were able to make within the community here, servicing the individuals. When they call me and they have a dire need for a medical appointment, to be able to just have a platform as easy as it is, it's unmatched.
For the Utah Transit Authority, MyHealthDrīv is currently testing and demonstrating the benefit of an e-voucher system for use with volunteer driver and voucher programs for health-related trips and mobility management. This effort is funded by the Federal Transit Administration Innovative Coordinated Access and Mobility Grant Program.
We chose the e-voucher project to help agencies that do paper voucher projects now to help eliminate administrative costs and administrative workload so that they can put more money back into those that need the trips the most. Some of the key benefits to the e-voucher system is that it allows agencies and organizations to verify that clients were taken to and from the locations that they wanted to go. Currently with paper vouchers, there's no way of tracking that information. So the e-voucher system tracks both the pickup and drop off of each client. It also then electronically pays the driver through our financial system so that the driver doesn't have to wait those 6 to 8 weeks for a paper check to arrive in the mail.
Our riders all have different mobility needs. Some need walkers or wheelchairs. So by having a driver that they consistently see and is familiar with their needs, it makes their trip a lot easier, and they don't have to explain anything, and they can move past that part and just have a comfortable ride. E-voucher allows us to validate that the ride occurred and that both the driver and the rider were in the same place using geolocation services.
The MyHealthDrīv demonstration has been going great. We've had a lot of ridership with a lot of different customers and different drivers. The feedback we've been getting lets us know we're on the right track forward. Collaborating with CommHIT has been a true pleasure. They've tested our software fully. It's been a great benefit to allow us to fix the software and get it to where it needs to be.
MyHealthDriv is provided by Community Health IT, CommHIT for short, a 501c6 at the Kennedy Space Center. CommHIT's foundational principles are health equity, health access, and dignity.
The transportation being provided through MyHealthDriv has helped quite a bit. I learned about MyHealthDriv transportation program through a service called Care Patrol. Care Patrol is purpose to provide transportation to different people in the area, mainly to nursing homes that can't get to certain places. With our program, that's one of our biggest issues. That's one of the reasons why they end up calling 911, because they don't have transportation to get to their doctor's appointment. So they call 911 to go to the hospital to be seen. Transportation allows them to get to their appointments. Also, sometimes it takes them to other places that might be necessary. So it's been a very positive response. Not only that we reduced the 911 calls, it was able to provide transportation to those patients of ours that don't have transportation.
At the Kennedy Space Center, CommHIT administers the Population Health Information Sharing and Analysis Center, or PHISAC for short. So CommHIT takes privacy and security very seriously. Here's what CommHIT's CEO, Kendra Seiler, PhD, who leads Wave 1 of the U.S. Department of Health and Human Services 405D task group that aligns healthcare industry security approaches, has to say about privacy and digital security of riders.
MyHealthDriv prioritizes maintaining the confidentiality of personally identifiable information, or PII, and protected health information, also known as PHI. CommHIT does not and will not sell or disseminate any PII or PHI. Any patient information that MyHealthDriv collects is for the purpose of the ride or de-identified reporting, for instance, for the ICAM grant. All CommHIT services, including MyHealthDriv, follow all applicable federal, state, and local laws, directives, and regulations. Examples include the Health Insurance Portability and Accountability Act, commonly known as HIPAA, and the Cybersecurity Act of 2015. Since we're here in Florida, we also follow the Florida Information Protection Act of 2014, or FIPA. MyHealthDriv works with its partners, drivers, and volunteers to protect participants' privacy and provide for the security of their PII and PHI while giving people the trips that they need to be healthy.
To learn more about CommHIT's MyHealthDriv, please go to communityhealthit.org/MyHealthDriv.